Okay, so this is Alan Leitner, and I'd just like to welcome you to the COVID Precision Location Data Workshop. Thank you for all joining. I want to thank our speakers and expert panel. I'd like to turn it over to Michelle first, so she can give you some rules of the road. So Michelle?
Hello, everybody. Actually, with all the feedback that we just got a little while ago, that was one of the things I was going to suggest everybody to mute their lines so there isn't any feedback. Also, other than the presenters and the expert panel, you could show your video, but everybody else, if you can also turn off your video, not so much as a distraction as well. There's also a chat feature. You can see below, there's like a little bubble with the chat. You can use the chat feature to ask any questions. At the end, when there is questions and answers, you could also, there's usually a hand, but I'm not seeing it right now in everybody's, but there's like a raise your hand feature, which is in the participants panel. Use that. But other than that, that should be it. And we could start with presenters.
Okay, thank you.
Oh, you're welcome.
So again, welcome to the COVID Precision Location Data Workshop. I'm Alan Leitner. I'm president of New York City Gizmo and a member of the Regional Committee of the New York State GIS Association. I'd like to thank Michelle Westfall of State ITS and Amy Jew of Hunter College and Gizmo for managing the logistics on the run-up to the webinar and for handling the webinar itself. And now I'd like to introduce my co-host, Ross Baldwin, who is the GIS director of the town of Southampton and chair of the Regional Committee of the New York State GIS Association. Ross has been organizing a series of regional conference calls since the beginning of the COVID outbreak. He's really done a great job doing that, bringing us all together. So Ross, you have some words to say?
Hey, good afternoon, everyone. Thank you all for joining us today for this workshop on how precision location data is being utilized in the fight against COVID here in New York State. I want to welcome you to what is geared to be a very revealing discussion into the efficiencies GIS has produced for various agencies across New York State during the pandemic. Very excited to hear from the presenters as well as our expert panel. We have a very distinguished lineup today that will surely not disappoint. I want to thank my co-host, Alan Leitner, for the endless energy and passion he has for GIS. He has led the charge for many years in many capacities for GIS, especially in today's fight against COVID-19. I want to thank our three speakers, Frank Winters, Doug Schutz, and Jim Daly. We also have, as I mentioned, the expert panel consisting of 3 panel members who will provide comments following the presentations. They are Professor Sean Ahern, Dr. Nadine Alame, and Dr. Casey Rondello. Following the panel discussion, we will have an open discussion, which includes time for questions and answers. Alan?
Okay, thank you. Thank you, Ross. So I have a little prepared statement here. I'll hopefully get through it real quick. Our purpose today is to highlight the use of precision location data that can be mapped to a specific building footprint or to an address point in support of operations and applications dealing with the COVID-19 pandemic. Over the past months, we have become aware that much COVID-related address data is being aggregated to zip code areas, which cannot provide the level of detail necessary to understand pandemic spread. This is because, in general, COVID case data is being captured manually, is not being fully digitized, and is not being geocoded. This applies to data capture at COVID testing stations, laboratories, and hospitals. Also, comprehensive and accurate address capture is not being done by most contact tracing operations, greatly limiting the kinds of tracking and analysis that can be done. Our 3 presenters today are exceptions. They are using precision addressing to support their COVID operations, and we wanted to give them an opportunity to show and tell what they are doing and how they are doing it, and to describe the benefits. We believe that widespread use of precision location data in support of COVID applications could provide great value in combating the virus. This is especially important now that schools are set to open, and we will want to use the best data we have to safeguard our children and our teachers. So our first presenter today is Frank Winters, who is the New York State GIO working out of Information Technology Department. So Frank, take it away. It's your, oh, you're just speaking. Okay, Frank, it's all yours.
All right, great. Well, thanks, Alan. I want to underscore Ross's comments and salute Alan's wonderful energy, and thanks for all the participants here. So let me geek out for just a minute. And in the name of this workshop, the word precision is used. Well, I'd like to really kind of dive into how precision, accuracy, and resolution all really define and come together. People use those terms synonymously, but they really have different meanings. And my friends from NGA say that precision is telling the same story over and over again, where accuracy is telling the truth. And if we also combine resolution, the ability to resolve smaller and smaller differences, all three of those things are part of the mindset that we bring that maybe others that are looking at this pandemic from a different lens might not have that same clarity. So precision, yes, telling the same story over and over again. When we have an address, let's get the same coordinate on that. And in order to do that, it's a repeatable kind of a thing. If we're using the same reference data, then we're using the same level of precision, and we agree 10 Pine Street is here. And if you use a different geocoder, maybe 10 Pine Street doesn't exist, and it says, well, I found 12 Pine Street, close enough. Well, no, it's not close enough. It's not repeatable. So precision, yes. Accuracy goes along with that. If you're actually using tools that degrade your accuracy and give you an incorrect answer, that's going to really follow this up. But I also want to focus on resolution, the ability to resolve small differences. So resolution really in two different areas, resolution in space. So are we assuming that a unit of geography appropriate for looking at the differences in the spread of the disease or its impact or economic impact is a county, in which case we're assuming that all of those characteristics are homogeneous across the whole county? That's kind of ridiculous. So why are we looking at cases by county? And Alan mentioned zip codes. Zip code also glosses over and melds together most of the interesting things that we could use to discern the real causes and to start to model the differences. Now, I don't want to put down anyone who's using county or zip code. And there's people doing fantastic work playing the cards that they're dealt in this. I'm really trying to change the hand, right? So we need to be providing more higher resolution, precision information in a way that is useful to folks that are really trying to understand the spread, its impacts, recovery, and all of that. So I mentioned spatial resolution, county being far too aggregate. I also want to mention temporal resolution, the ability to resolve in smaller slices of time. So the governor just announced a pilot program to measure COVID rates in sewage treatment plants. So there's one sample that can be taken and test 1 million people every day, right? So we get a much broader spatial resolution, but a much tighter temporal resolution. So I'm really super happy about that. Couldn't have happened couldn't happen soon enough, but a great time for the baseline to be understood as rates are relatively low, but we're starting to reopen schools, we're starting to reopen a lot of our economy. So understanding the spread and its impacts, we've said all along that, to me, it's going to depend somewhat on the geographic density, but thinking about an area like New York City, the census tract might be kind of a sweet spot in that, yes, we want to get down to the precision of a building, but many of the people who will be providing value might not have access to that data if it's considered too resolute and a concern under HIPAA. But if we were to aggregate at least by census tract, then we can combine that data on cases with lots of the rest of the information that the Census Bureau puts out and others like PolicyMap put out to get to those factors which might help to understand the variations in the spread and its impacts. So certainly the reopening activities are not going to be homogeneous over a county or over a zip code. The effectiveness of our messaging and the degree to which people adhere to warnings, that's not homogeneous over a zip code or a county. So really getting down to at least census tract, and then inside the curtain where HIPAA concerns are, we're really maybe not making that data public, but still being able to study that for science right down to individual address points. And it's not like it was 10 years ago where we would have been kind of guessing where these address points are. My team made 500,000 edits since this time last year on our streets and address data. We have a really good handle on where all the address points are. And, you know, we hear that, okay, well, there are some labs that are doing work in multiple states and they can't use something different for every state. Well, that's why we also have an initiative to roll together all of these address catalogs into the National Address Database. So the structure is there, yet not fully populated. So something to look forward to. We also have a plan for consistent geocoding that's up to date nationwide. One of the interesting things that that happened was the governor's office put up a website and has a hotline for complaints. So people hanging out outside of a bar, or employers in facilities who are high density and no one's wearing masks, or whatever it is that people are complaining about related to the density of people. And they put the entry form of the address behind our geocoder, that when someone enters an address, right there while there's fingers on the keyboard, that goes out to our geocoder, says, is this a valid location address, and brings back, yes, here's a correctly spelled, correctly formatted. And they wound up with 40, 50,000 pretty high quality addresses, so they really know where those addresses are. So I want to jump just to a thought on the downtown areas. And if we start to look at even economic impacts on a municipality area, and we use that as our unit of geography, again, we're going to mask a lot of what is really sort of troublesome. And if you think about what's happening in our downtown, right now there's record high numbers of commercial properties for rent, where businesses have said, okay, we're going to work from home. And many of those businesses are saying, ooh, we can continue to work from home and I can save that expense and not pay for the overhead of this business. So our downtown areas, I think we're really take some serious work to keep vital. Over the last few decades, we've had a really good resurgence of much of our downtown. Has that just stopped? It may have. And then maybe that's offset. And we use Rochester as an example. Rochester has lots of vacant office real estate now. Restaurants are suffering. The support businesses around that are suffering, as they are across the country in many locations. But Rochester has also reopened the Kodak Industrial Park to increase domestic manufacturing. And they're manufacturing a lot of pharmaceuticals that otherwise would be made in China. So is that an offset? And if we look at that whole problem in the context of the whole city, we might think that those things cancel out. But we really have a geography problem. Those are not the same location. That industrial park is not the same location as where those office locations are. So it just underscores the need to really understand the resolution and look at all of these issues, from the spread of the disease to its impact on people to its impact on our economy, with the right unit of geography to understand the differences. So we ought to be thinking about address geocoding on input. If we have an address and we get that geocoded, then we can choose to aggregate that data to any unit of geography just by intersecting it with the right polygons. So whether that's people signing up for a test, or people showing up to a test site, or the medical providers, or contact tracing, complaint tracking, businesses registering, and test sites, all of those things, we can get all of those street addresses nailed down and have really high quality data on input before it becomes a huge science project. So that's some of what the good news is. The tools are there and available. Happy to work with anyone who wants to connect to our geocoder. connect on input right when you're building that form or that application to collect addresses. Then you can use whatever unit of geography you like. I'd like to also point you to the Pandemic GIS Task Force. There's another event. The Hot Wash Part 2 is coming up on the 25th, and you can register for that through the NAPSG website. So I'll defer to the next speaker with a little bit of my time.
Okay. Ross?
Thank you very much, Frank. Thank you, Frank. So next, our second speaker today is Doug Schutz, Acting Commissioner of Planning and Public Transportation with Rockland County. Doug? Oh, I think you're muted.
Can you hear me?
Yes.
Okay, I have to go through the phone. Something's up with the camera. I just want to make sure everybody can hear me. All right, let me share my screen. Everybody seeing that?
Yep.
All right, great.
Looks good.
All right. Thank you very much, Ross. Good afternoon, everybody. So my titles as GIS Director and Acting Commissioner of Planning are key indication how I'm going to share our experiences in Rockland County with COVID. I'm going to share some of the technical products created by our hardworking staff, Scott, Jurgen, Karen, and Gibson, but I'm going to spend a little time as well on the administrative side of life. Like most of you, I didn't go to school to learn the administrative side of GIS and government. That comes from experience. You have to come up with your own strategy, your own playbook that really works best for you. While the administrative side is, certainly probably much less glamorous to many, you have to give serious thought and planning to it. I hope you find some value in what I'm going to present. So to kind of set the stage, the Rockland County GIS team is located in the planning department, where we're the lead agency for GIS development in Rockland County. That was defined years ago by county executive order. We provide GIS support for county government overall, and our data development responsibilities are in tax map maintenance, address street maintenance for 911 systems, district mapping, and much more. We have a great deal of experience in providing support to our emergency services for emergency management and planning aspects, including storm or flooding events and emergency planning drills. Our experiences and relationship with our health department include working on prior public health issues such as West Nile virus, and I'll talk a little bit about that because that's very important, as well as our land use planning efforts. I wanted to share a little bit more about background and strengths with our partners, as it may make us a little more unique than some. First, we get strong support from the top, our county exec's office. They've been very supportive, providing additional funding, opportunities for some training. We've taken, certainly like some of you, in Esri opportunities, Lean Six Sigma and New York State Lean training for myself, several others, and some other members of the team that have involved in some of the departments. And additional investments, which recently led to a new GIS portal, which helped to serve some of our products. We have strong relationships, certainly with health and emergency services and others, because we made so much data for them. And also we promote our activities. You kind of have to sell yourself at times to other departments, sometimes creating various prototypes so that they're familiar with the powers of GIS, so they can visualize it. Lastly, we're a small county, and that certainly gives us a leg up. Our relationships with our partners, first we must understand the roles and relationships. Each department has different missions. How do you operate, for instance? You operate in silos? Are there areas overlap, for instance, in communication or technical discussions? If so, how much overlap is there? Is there duplication? The goal should be at least some overlap for communication and maybe decision-making, that you're having technical meetings together and so forth. So I put together a few diagrams below, kind of representing isolation or silos. B, that there's some level of communication. C, that demonstrates some level of overlap, and that could vary by many different degrees depending upon who you are. And D, how I envision GIS is at the center, and everything kind of goes around it. I'm sure you all think the same as well. So we can come up with our own diagrams for our own organizations, but it's kind of a, I just wanted to kind of give a representation how I view things. Change also does not happen quickly. It evolves. And so that was important certainly for us throughout the years. Our roles for GIS as it pertained to COVID, our responsibilities included geocoding COVID positive cases. We created maps for internal uses and press events at various levels of geography at times, took advantage of the opportunities certainly from Esri by developing and maintaining dashboards. Scott of our team was the architect in setting up a lot of that. The first one that was set up was just a basic COVID site, and I'll show you these in a minute. We published a second dashboard based on New York's unpaused regional site, but the problem is that didn't give just Rockland specific information. So we created one that was specific to Rockland based on data. And then we created a third one for internal purposes, which was also based on New York State early warning regional site. We launched ArcGIS Online internal applications to display data and work with our administration and our health department. And lately we've been working on applications with economic development. It's important to note certainly that our role was a progression as things moved along. It evolved after demonstrating our abilities, often through prototypes, many discussions with the administration, with health, and like I said, lately our economic development team. It was not identified certainly from day one. This slide shows, I want to talk a little bit about personal information and HIPAA concerns. We must protect, obviously, against the release of this information. Does your data or does the data that we're working with contain personal identifiable information? Does it contain personal information with health information that can be linked to an individual? We reached out to experts. I suggest, that's a great way to go. We got guidance from our legal department, for instance. One of the phrases that stuck with me by our county attorney is just make sure that there's no direct connection from the beginning to the end. I thought that was more certainly generalized, but gave us a lot to think about. And our health department was always key and instrumental in their guidance to help protect against confidentiality, security, and abide by HIPAA requirements. Listen, from a GIS perspective, we all get very excited about the products we create. We want to be able to push it out there. But at times you really have to listen to the experts. Evaluate your procedures for various processes. Security measures, sensitive content. Do you need to limit access? Do you need to control what's publicly displayed? Evaluate your software. There's differences just in working with the various products, and their capabilities. And then we certainly also were conscious and cognizant of the fact that we had to control our data by geography or scale, or what data layers we would have on, especially depending upon our audience. Collect all the information possible to make your best, most informed decisions. Sometimes they're tough choices. Then you really need to pause. You need to really evaluate, reevaluate prior to publishing, especially when you're working with personal information. I can tell you that internally we didn't always agree, but it's good to have those discussions. The challenging part is that we're having those discussions during a health emergency, and we lacked the background and maybe the guidance outside of reaching out to our experts long before the emergency. Our steps, additional steps, you just saw some of the information I put on the previous slide, but our health department removed sensitive information and health information. We were provided in the planning department the ID, address information, isolation start and end dates. And that became very valuable for some of our other exercises. Data was encrypted. Geocoding was performed off the network. We aggregated to various levels of geography, zip code, tract, block groups, cells, hotspots, clusters, and so forth. So we did a variety of things, but unfortunately early on had very little time other than just some of the basics. Turned off layers, like I said, when we work with products that might go public, we're doing it out of caution. You know, if we get more guidance that helps us to do a little bit more, certainly we'd love to, but such as we didn't release aerials, buildings, parcels, local streets, and we controlled the scale of the map. For ArcGIS Online tools, we password protected our, you know, access and made that available to health in our administration. And we had frequent conversations with our health department. Our colleagues there were great, and we're very fortunate to have that relationship. This slide shows a little bit about some of the challenges. Early on, we only got zip code geography, and it was a summary table, and that was provided by health, like I said. That source came from through New York State DOH. Initially, this limited our ability to develop products at other levels of geography outside of zip code. Reported cases by New York State needed to be confirmed by our local health department. So there's this issue of reported at the state level versus locally. Health wants to confirm everything to get accurate depictions of really what's going on. Missing information had to be filled in. Certainly these individual records needed to be scrubbed by our health department. They put a lot of work into it, and unfortunately it took a lot of time, and so we were getting data, you know, at some point it could have been weeks later. So that became a big challenge. There's many different sources of data as well in order to have a really comprehensive picture. There's certainly the state health department data. We also got daily reports from our, in addition to filtered through from our local health department, but through our local hospitals and our medical examiner. Finally, another challenge was that some of the state metric boards, dashboards, were developed with that in mind, and understandably so, at the regional level. That didn't help us at the local level. So that's why we ended up having to create our own metric boards so we could evaluate data locally. Some health department challenges. I think this is my slide on empathy. Knowing the challenges that we go through, I heard and saw what our colleagues faced every day. I've read quite a few articles that mention the same thing. Oftentimes there's antiquated systems, poor data quality, staffing, funding, so many challenges that they deal with as well. So while we get frustrated at times, that we can't get data to certain levels, we all have to be empathetic. And I put a few quotes up there from some of the articles that I read. This is our first dashboard, which was early on showing zip code geography, not by choice necessarily, but by opportunity. That's really all that we really had early on, and we wanted to stay consistent for the public. This became a public site. You see in the upper left-hand corner, some of that comes from the state data. In the middle, that's hospitalizations from our local health department, or from our hospitals. Our death data came from our medical examiner. And then we have different tabs there on testing, hospitals, and on the right side, reported versus confirmed and deaths by place. So this became our initial lift. This became our second public dashboard, which was based on the unpause dashboard at the state level. This starts to show some of it's based on the 7 metrics at that level, and this was launched really to accomplish the same. Like I said, focusing on Rockland, we continue to update this daily, thanks to the team, and publish this as well. This was the third one. This is an internal product. Continue to maintain this as well based on the early warning signs. So again, this information we're getting from state data. This comes from the HERDS database, and we update that internally so we can monitor and see how things are progressing in the event that we really need it again. And certainly the case that we all agree is hopefully not, but we do have it. The next 4 that I'm going to show you are generated from the total positive cases, the confirmed cases, at a point in time by different geographies. This first one is zip code. So you'll see and I'm going to match the dates. This is back in June. I'm going to match the dates so that you get to see the different patterns when I go from zip code and what the story's telling you down to census tract, down to census block, and even cells or clusters. So you start to see when I go to census tract what happens, and I'll toggle back to zip code as well, the concentrations and the little more targeted area. But when you start to come to block group, you start to see where those isolated areas are within those zip codes. And when you go all the way down to a grid cell level, you start to see where within, say, those, as I originally showed, the zip code level, where within the zip code, for instance, those higher concentrations are, so that if you have to target, for instance, education, enforcement, discussions with businesses, for instance, it gives you a little clearer picture. So some of the information was shared back with our administration so they could have some of those conversations. So if I go back all the way up to zip and then work my way down, tract, block group, and then grid cell, to show some hotspots. To Frank's point, you see why it's so important that we need to get down to more localized level, but to do it efficiently. In our case, certainly it was a heavy lift and presented many challenges. So to kind of start wrapping some things up, just some lessons learned. Figured I'd share that, from our perspective. As a result of the existing systems and the intake process of the data, we all know that it was too much time, certainly, to invest in scrubbing the data and the decoding. So we really have to recognize in a public health crisis, if we haven't accepted it yet, how valuable and important DOH is at the state level, at the county level. The relationships that you build with them, it's all very, very important. How they're dealing with challenges with data, staffing, workflow issues, technology, and policies. I think they took a leap of faith with us, certainly based on our experience, and I think that worked out very well. You have to understand and support each other's goals and responsibilities. There are great benefits in cooperation. Some level of overlap, or it certainly has helped us in improving communication and decision making. We've learned that GIS products are a tool in the toolbox, and I can't emphasize that enough. It becomes a tool for health department and other people. It's not the end all that be all, but it's a product because we're really a support staff element to their overall effort and challenge. It's important to develop a strategy. We had a regular communications with health and the administration. These were technical strategy meetings at times to develop support and agreement prior to public products being released. We created and demonstrated prototypes to better educate our partners. Huge investment. There were a lot of weekends, late nights that some team members dedicated, but it helped to get others to visualize what was really going on and what could be presented. So it was a heavy investment on our part. In assessing risks, there were challenges in dealing with sensitive personal information and the concerns of what we can access and display. Evaluating that in the midst of a health crisis is certainly challenging. Working through this ahead of time, that would be the goal. Don't rush to push everything out. I can't emphasize that enough. Doing so could certainly negatively impact a public health strategy, something that we learned throughout this process. Assess your weaknesses and find ways to minimize them. Certainly with the data, we all know the weakness in data certainly resulted in wasted time, little time left in our case for analysis. As a result, decisions have to be made, but you want to be able to use the latest information. When it sometimes could be a week or 2 weeks old, you're making decisions on that. That's tough for everybody. Software, there's certainly limitations with licensing and tools, but we took advantage of what Esri offered. Challenges in the process and assessing, exchanging data or accessing data, we made some adjustments in order to help out with that. Staff resources, we really never overcame that obstacle. It resulted certainly in a lot longer hours, tireless nights, like many of you had to endure. We should have built those previous relationships of resources earlier, or in advance of this. We should be tapping into opportunities at GIS Core and certainly academia. I'll mention that in my last slide as well. There should be a greater role of GIS involvement in future pandemic planning. We've already been approached locally that we will have a seat at the table on that. And we must continue to share experiences and cross-train staff. Events like today hopefully are very helpful in learning some of those things, along with the hot wash exercises that some of us have witnessed. Most importantly, we must all learn so that we can help to reduce future loss of life. And my last slide is just some recommendations. Strengthen those relationships, improve those communications. We have to educate our decision makers, keep pounding the pavement, our elected officials, health departments where they weren't working with GIS personnel. Gotta keep pushing it to see what we can do, or to strengthen those opportunities or improve those opportunities. Understand and respect your partner's roles. That's important. Evaluate existing models. Break down those silos, for instance. Build prototypes if you need to, or take some of the lessons learned that you might hear today or some of the hot washes. Share that with others, as certainly we've done. Identify what those lessons learned are. Like my previous slide, strengths and obstacles. Maybe you have to do a full SWOT analysis. Assess where we need more guidance and clarification as a whole and individually. Identify where we need policies top down, from the state to the counties, and maybe just within your own organization, and establish what that role of GIS is, and provide clear guidance on the use of data and restrictions. It would help non-HIPAA professionals like ourselves if there was, almost like a cheat sheet of really what we could do, and having that laid out in advance and that's something I hope that we're going to be able to work through based on the lessons learned internally. Lobby for change. Geocoding, we know, must be done at the source of entry. We must be able to analyze at a census level geography. Frank touched on that. It's important for that geocoding to be at the source for testing, contact tracing, even business registrations. And that's something Frank and I and the 9 county planning directors around here, we've started to have some conversations on that. Let's see, this could have been certainly time better spent had we had that, so we could be analyzing the data. We must be able to get census level geography, obviously. Workflow analysis, evaluate the process, something that we've done here. I've got a project with about 8 departments. I'm working with staff here along with other departments through Lean training and through the New York State office, as well as Lean Six Sigma training, working about how we can improve a process. Eliminating waste where we don't need it. So maybe that might be opportunities for certain offices, either at the state and or other counties. Even our own process for this may need to be reevaluated, and recommend those process improvements. We have to find ways to get creative, to get academia and volunteers involved. We need to forge those stronger relationships internally and externally with colleges, maybe GIS Corps, so we can help support our efforts. Our biggest challenge there and hesitation is bringing in additional support in letting other people touch sensitive information or what could be viewed as sensitive information. That was always a struggle. And we need to do that certainly in advance. And then lastly, we're refocusing our efforts now on supporting economic development. These are challenging times that we're in and probably going forward. So we're working very closely with our economic development team. It may be a long-term recovery. It's going to be competitive. It's already happening, where I can tell you here locally, there's a lot more interest in the houses. People have been moving out of New York City into the suburbs. Businesses, they're advertising all over here in this county for office space because of people don't have to commute. So it's going to be competitive, being competitive between states, between regions, and even at the local levels. So we're really starting to step up our efforts there. And lastly, I just wanted to thank you for the opportunity. I hope some of the points I've made today are of value. And thanks to my team here. Smartest thing you can do as a manager is to surround yourself with much smarter people. And I think I've done that. So thank you.
Hey, thank you very much, Doug. You guys are doing great things up there in Rockland County. I appreciate your presentation. Next, I'd like to introduce the GIS Director for Suffolk County, Jim Daly. Jim.
hear me? Yeah? Was that a yeah? Okay. Hey, thank you, Al, and thank you, Ross. I want to thank you guys for allowing me this opportunity to present today, because I'm flattered and humbled that you've recognized that work in Suffolk County, and to present here today is I'm honored. For those of you that just saw Doug's presentation, I just want to say I can make this real simple and say ditto, because that about sums it up so much. Doug hit so many of the points that I've come across as a GIS manager in my county. So he hit on a lot of things that I went through. I just want you to know that. And I'm not going to touch on everything that Doug touched on specifically, but I do have a lot to share with you, and some creative ways in which we developed address points, COVID patients that were positive, and other types of applications that we designed because of that and out of that. I want to start off with a little bit of a story that when the pandemic hit and we were getting into the throes of it, I also teach a class at Farmingdale State College, and one of the areas we teach that I teach is heat mapping. And I borrow this lab lesson from Esri, and you can go to this site and you can see it. And it's about the cholera outbreak of 1854. Can I share my screen now? Let me see. Okay.
Got it.
Got it. Okay. So yeah. So as I was saying, I was into this lesson teaching about the cholera epidemic of 1854, and for those of you that are familiar with it, right? It's about this basically an outbreak by Dr. John Snow, who decided to use a map to start to identify where all of these cases of cholera. And Dr. John Snow did a lot of research here. And what he did was he found, or he hypothesized, that this was all being developed or being transmitted orally, or it was being consumed orally. That quickly led to his assumption that this was being consumed through water. And because there wasn't running water at this time in Soho, in London at this time, they were accessing the water through pumps. So the first thing he did was he went out and he got a map, and he started to specifically locate the pumps, the water pumps in this community. Once he did that, he started taking all the cases and identifying where all the deaths were happening. So he started marking those off with little hashes. And before you knew it, he had a lot of hashes in a little area, what we call clusters, and he soon realized that it was the Broad Street pump that was causing the outbreak of cholera. Now, I bring this up not as a history lesson, but because when I was teaching it, it dawned on me, you know, a doctor 150 years ago can understand the importance of exact location of certain phenomena, whether that be a water pump or a patient who is sick or dying. So if a doctor in England, who wasn't really even an epidemiologist at the time, he was a surgeon, becomes an epidemiologist and incorporates the uses of maps, I think that pump right there just basically has so much GIS to it, so much history in GIS. If I ever get to London, that'll be one of my stops, and I'll take a picture of it. So I just bring that up again, not as a history lesson, but as for all of us to remember that this is a fundamental concept we're dealing with. COVID, yes, it's a unique strain. It's incredibly strong and it's dangerous. But again, we have been dealing through this with time, and the fundamental science behind it is really the same. It's just the techniques that we're using are more technical. So let me, and for those of you who want more information or want to go actually do that live, you can do that right there. It's through Esri's Learn ArcGIS. It's a lesson gallery, free to use, I believe. So let me paint the picture here in Suffolk County. My name is Jim Daly. I'm the GIS manager. I work in the Department of Information Technology in HIPAA, and I'm lucky to have a really talented crew of 5 people. Eric, George, Doug, Santosh, and Shannon. They have really done so much work, as so many of your teams have as well. And I really just want to say I'm the messenger here today. A lot of this work fell to them, and they worked many, many long hours to get it all done. We've really made some good stuff because of their help and their work. I also want to let you know that we are an Esri shop. We have our GIS is an Esri platform, and we use Portal, Esri GIS Portal to support most of our operations that we've been doing for COVID. And I want to talk about address management and geocoding, because really the two of these go so hand in hand. I think it's important, and I would be remiss if I didn't start to mention address management, how we do it in Suffolk County. And I want to say that we have a very good pre-existing solid foundation for address management. And to that, we owe a lot to the New York State GIS Program Office. Thank you to Frank Winters and his office. Cheryl Benjamin, for those of you that knew her before she retired, you know, my hat's off to her. It was serendipity that she came along one afternoon and said, Jim, you know, you're right for us to convert all your address data into the next-gen E911 schema. Let's do it. I said, all right, you know, by the way, the police department and Fres, they're all looking to get my data, our address data converted for this use. And she really helped us do that. So we got that done, and kudos to the New York State SAM office program. So Suffolk GIS today still coordinates with SAM office for county and town address data. We do this religiously. I've got a few people in the office every day coordinating with this staff, and it's been a wonderful relationship. So why do we continue to do this is probably your question. The first answer really is, well, first off, they went ahead and did something that was going to cost Suffolk County some money, because I was going to have to get a vendor to come in and help us do this. So New York State GIS program office did this for us. They made our address data ready. We continue to work with them because, well, you know, it makes sense, because if you're going to have a crisis hit, you're going to have the state emergency management office on top if it's a state emergency or a national emergency, and in that case, if it's a federal emergency, you're going to want everybody using the same address data. Now, this wasn't all quite in place when Sandy hit, so it dawned on me then that, you know, this is really important that we stick with doing SAM work with New York State, so that when a crisis hits again, we are ready, that we are working with the same addresses. And lo and behold, COVID-19 hits. So, getting into the thick of it, and this is really a story from this point on, we start noticing that the 19 addresses are coming in from the New York State Health Department. So I'm asking the question, you know, and again, I'm like a lot of you, I'm not in the war room, I'm not at the strategic planning table, as it were. So I really, I'm trying to figure this out, offering what I can do with GIS and how can I help. What I find out is that the addresses are being free typed in. For that, I just was like, what? And then there's no use of the same address data in there at all. So that kind of, you know, makes me kind of ask the question, why isn't New York State using the New York State geocoder for this addressing? And I know Frank is plagued with some of the same issues I'm plagued with here in the county at a much greater level. And that is, you can lead your agents, you know, your agencies within your organization to water, but you can't make them drink it. So I realized that, you know, and Frank explained to me, this is a different culture we're talking about, but I think that HIPAA issue got in the way there. Like, why can't we touch that directly? So what I started to do then was identify the data flow process and started doing, you know, I felt like this guy in a dark room who's been invited to help, but you can't see anybody. And you've got to bump into them and tap them and ask them, what can I do to help you? And then you start to find out how things are working. I still feel like I'm in that dark room most days. But anyway, it begins at the lab, right? And they start free typing the addresses. Now this is, might have changed lately. We can discuss that in a minute. But where it all is right now, I know this is pre-ComCare involved. So I'm just going to talk to this from the point where there's no ComCare. So it begins at the lab. They free type the addresses into the system. The data is sent to, I believe, the New York State ITS consultant. I'm not exactly sure who that is. And then that data is pushed into something that's called an Amazon data lake. I'm still not exactly clear what that is. But it ultimately ends up in the New York State ECLRS system. And this pulls the data from the data lake. So this is what I have been told, and I have been confirmed this in an email from one of the consultants at New York State. If this is different, then please let me know at the end of the presentation during our discussion. So then at this point, Suffolk County pulls the data from New York State ECLRS. Now, you can see here, this is quite a process before Suffolk County gets the data. So this is the stream of events that I'd like to really see us address for the next crisis that's going to happen. Because if we're going to coordinate at a county, town, a state, and regional level, this sort of thing really has to be vetted, and I think perhaps even, you know, all agreed upon as well, because I don't think it really is well understood by many people who are still in the process. So Suffolk County connects to the ECLRS system, right? What is it? Well, this is an electronic clinical laboratory reporting system. So this is where the labs report their information into this state system, and this is how the county gets it. So how does the county get it? Well, we get access to, from what I believe, from what I've been told so far, is a single user front-end web interface. So this is a user account that's offered to the county health department, and you can access it on a, what I believe also is, I haven't actually used it, is, but I have seen it, is that you get a case-by-case screen. So there's no ability to download or connect to the database. You have to access it through this front end. It's basically the viewer. So my big question here is, why not offer this as a secured REST service to connect to? Because we're going through a lot of pain and suffering to try and get this data into our system so that we can strategically plan locally to do what we can do here locally to help the COVID efforts. So then what happens here is that the health department says, here, BI team. So we have a Suffolk County business intelligence team. They are handed the account, and what they do now is they have an idea and they take a play out of the hacker's playbook and they develop a scrubbing robot to copy the data into a new database. How ingenious, right? Now, all the time, from what I understand, it all stays within HIPAA compliance. This isn't data that's being let out. It's all being handled by people who understand the HIPAA rules. So, if you're getting access to this screen, you have access to the data. What's the difference if you're automatically sucking it into your and creating a new database? That's great. So this creates a new secure database in the county, and we know it as the Salesforce database. We have Salesforce in the county, and we use that for a lot of our information analysis. So that next, up comes Suffolk GIS. We're on deck. We're in the box now, and we're asked to pull the data from the Salesforce database. And that's a little painful too, because now there's a little bit of a turf thing because it's their database, and now we have to create a new database. So ultimately, what we do is we start writing scripting tools to automate the workflows to do these timely updates. So this data is coming in fast. It's coming in hourly, minute by minute. New cases are coming in. So the robot is constantly scrubbing and repopulating the Salesforce database, which means that we have to keep running from our database all these scripting tools to keep all of our applications and data current as well. So this creates a lot of work on our end, and this is where a lot of the back end work went in, but it really paid off because once we had the scripts done, we had a lot of the conversion of the data done, we were able to map the data, and all the aggregating of the address data was done, all automated through GIS scripting. So we batch geocoded the addresses from a CSV file, we populated the database, we made a geospatial, or I should say an enterprise database out of this. What we realized when we got done with that, when we finally figured out how to do it and got it done right, we were able to then use that geocoder, our geocoder, which again is in sync with the state geocoder because we coordinate daily with them. So we had the same address points. Well, we realized that there was many bad addresses in there. And in the early days of this COVID pandemic, there was as much as 20% of them were not found. So this was a little bit troubling, but nonetheless, we pushed on. And this is ultimately what we came up with. Now, you're not seeing all 44,000 dots here, but they're all clumped together, but they're all there. And if you were to click on any one of those dots, you would see all the information that came out of the ECLRS system. So we were able to, or for those that we could actually map or locate. So we had a lot of ones that we couldn't, and then we had some false positives that shouldn't have been there. So we had to weed that out. Now, I just want to bring up this point is that we spent a lot of time cleaning up addresses that weren't in the geocoder. And this is something we have to keep in mind if we're going to initiate a state geocoder at the higher level. Who is going to do that cleanup when you can't find an address that goes into the system? And this is maybe a discussion we have to have, with the state people, or it's going to have to happen at the local level. When you bring it in, you're on your own with it. I don't know, but it is troubling to us because it demands a great deal of our time and it consumes a lot of our human resources. But we do it. So what do we do with all that data? Now that we have located all those positive case points, we need to start making use of them, good use of them. And really what we had is we ended up with internal and public-facing applications that we were able to help with. I'll start off with the public application support. So we developed the dashboard like many that you've seen. The difference here is we didn't do it in ArcGIS Online, we did it in-house on our own enterprise portal. And we did do the spatial aggregation at different levels. We did this one, as you're seeing here, at the town level. We then did it down to community level using the census designated places. And then we normalized that data to give an overview to kind of level the playing field with what's going on with COVID. And then also what we did was we made it interactive so that many of the public found it very useful and helpful for them to do further interrogation of the data. So that was the interactiveness of the application was very helpful too. But this was what we did publicly right off the bat, and this was a big help. As a matter of fact, you can access it yourself right now if you want to go to the Suffolk GIS portal. It's available for anyone to download there or to open up there. So we also used that public-facing app for public reporting. So the county executive had used it routinely, so it became part of the face of his daily briefs with COVID, and it was very useful. And when we had taken the map down to redo the process, once ComCare was coming into the picture, we had many, many calls, where is the map, and people were getting upset. So we know that the public really wants to see a map when it comes to something like COVID. It's very important to have. And I don't think a lot of people at the higher levels were thinking that this was going to be a map-centric project, but I don't see how they couldn't. I mean, I know I'm preaching to the choir, and you're all GISers like me. I don't see how they didn't see this as being, you know, a necessity. And why did I have to fight so hard to make this map? Because the data should have just been sort of geospatially ready, but it wasn't. And that's the bigger question. Why isn't there, and I'll get to this, and I'll wrap this up when I talk about that. But that's the big question here, is that who is not thinking geospatially at the strategic planning table when this thing was all starting? Why aren't people there that know GIS, that are in the war room planning these efforts with them, making sure that the data and the databases are geospatially ready so that we have standards in place and that we can all at all different levels of government do GIS work? So I went off a little bit there, but we also offer the public map service. Because this is a public dashboard, there's a public map service that has to be out there. And what we found out is that people were using that. Academia was pulling from this, making their maps and drawing their conclusions. And also Newsday, the local newspaper, was using it to populate their information on a daily basis. So they connect to this service and consume it, and they make it their maps, and they present their data on a daily basis in the newspaper. So it was very helpful there as far as a public service. Moving to internal support, we worked primarily with 4 organizations, and I work agencies within our organization, and I really want to say primarily 3: police, OEM, and health. Public Works we did a little bit of work for, but that was really to support OEM as well. Let me start off with police. Police came to us, they were one of the first agencies, really. I know health was a little slow to come to us in the beginning, but they understood what we could do, because they had their own ideas. And I think, you know, to Frank's point that he made so many times, that they have their own culture. And what they like to do is do things on their own, and they got HIPAA to work with, and they don't want you pushing in. But the police said, hey, can you help us? We want to see where all of these cases are, so that when we have policemen responding to these houses, we want to know if there are positive COVID patients in there. Now, I can't zoom in any more than this, because you know, it would violate the HIPAA rules. But again, the police now have access to this internal application where they can click on the map in their precinct, in their sectors, and know whether or not if they're responding to a place where there is a positive case. Then they came to us later on, and it was the police chief who said, hey, you know what, there's a lot of points on the map. We're getting deep into this now. It's months into us. You know, I just want to know where the cases are that have been tested positive within the last 14 days. And this goes to many of Frank's good points, the temporal point, right? So it actually came to us. We didn't actually do it right away. We were thinking about it, but we were like, well, if no one's really calling for it. But the police chief said, can you do that? So we built an app that's basically has a time slider in it now, or you can put the time date in it so that you can develop or see where the cases are, you know, within a certain time period. So this became very helpful. This also then became very helpful to the health department, and they picked up on it, and then now they're using it too. In OEM, we did a lot to help them with geocoding. We geocoded their hospitals, of course, their adult care facilities, their nursing homes, and back it up. So we were able to identify for them some of these critical areas that they had to pay strict attention to during this outbreak, because as we all know, these were the very sensitive areas. So that was very helpful to them. Public Works, like I mentioned, we helped them actually start to identify address points or addresses where there were structures that could be used as potential medical facilities if we had to start standing up makeshift hospitals. So that was very helpful to them. The health department, we started initially just by developing heat maps, okay, then doing trending analysis. And here you can see things were starting to trend pretty good by the time we started doing this. And then and this is where we are right now, we're doing cluster analysis. And this is really kind of, I guess, landing on community analysis as well. So what we're looking at here is, you know, an event that then has so many people there, and then they're being traced, if you will, or they're being located. And again, I think what we have to really understand here is the differences between, you know, location, tracking, and tracing. So we're using a geocoder for location, right? Now we're talking about contact tracing. So you ask somebody in the health department, and that's really tracing a person to the next person. That's tracing, right? And then we talk about tracking. Now we're starting to talk about in Suffolk County how we're going to track cell phone data. Supposedly anonymized cell phone data will be used so that, you know, you're going to get a text out of the blue saying that you were in contact with somebody who's positive. Now, how did an agency get my phone number to tell me that? That's another ethical question I don't even want to get into, but this is what we're looking at right now. So there's location, there's tracing, and there's tracking, and they're used interchangeably so many times. I think maybe sometimes we need to discern what we're exactly talking about, because like I said, if I'm talking to a health representative, they're thinking differently when they're talking tracing. I'm thinking tracing like a route. They're thinking tracing like person to person. So sometimes the syntax has to be cleared up so that we know, you know, we're all talking the same language or about the same thing. So I'm really kind of coming to the end of my story here, and it's really about, I think we need to get the message through. I've been speaking to a lot of you throughout this pandemic, and I think what I've seen in talking to my people too is that the admins at the upper levels that are in the war room that are doing the strategic planning really aren't understanding the importance of so many things. And it really starts with the ability of basically to simply map an address, and not just to take it, and, you know, I think the people in the labs are doing great jobs, and everyone in the whole downstream or event stream process is doing great. But some people really don't fully understand the importance of maybe just taking that address. And we need to understand, or they need to understand, why address standards exist, why we use them, why they're so important. And the geocoding services, we all know that that's what this takes care of. So we need to explain what they do and what they mean to those who are downstream in this process. And how this all affects the ability to map addresses in GIS systems at all levels of government, right? So we've got, you just seen my example of how we were being creative to do this. We were on our own, we did this on our own, but we were able to get the points out, and we did it. We created our own way. But really, did we have to go through all those steps to do that? I don't think that should have been the case. I think this should have been an easier way. And I really want to get back to that question, you know, of why can't we get a data service, a secure data service from the state agency that has this data, and avoid many of the processes that we had and hoops that we had to jump through. So, you know, and the other thing a lot of the administrators have to understand is how accurately mapped address translates into accurate geospatial analysis. So now people are starting to understand, you know, we've got the lay of the land, we've seen the picture, we see these case points, wow, there's so many of them. Okay, so now let's start getting to, the discussion turns to, let's start analyzing, you know, where can we see direction, where can we see trends, and this is what's happening now. Now, if we don't have accurate data, if we don't have accurate, and this is again to Frank's point, precision and accuracy and knowing the difference between them, you know, this is something that you don't really expect non-geospatial professionals to understand. But as we do, it's incumbent upon us then to really kind of push this up, to make them understand, you know, why that accuracy, why that precision is so important now at the beginning, because I got the hand to me so many times. Not now, Jim, you know, we're trying to figure this out. I go, you don't understand. If you don't let me in now, down the road, we're going to have the problems, okay? But I got to, no, we understand address is so important. I go, but can you tell me how you think they're important? Because if you don't tell me how you think they're important, they're not the same importance that I have, then we have a problem, or we will have a problem. So that was the thing that I was most concerned about early on. So, you know, just to wrap it up, it's GIS professionals need to be in the strategic planning room at the beginning. How do we do that? How do we accomplish that? And to, you know, I want to thank Frank for all the work that he has done to try and get this or make this happen, because it is happening. It just took a lot. It took a pandemic, I think, now for people to see it. That's a good thing out of a bad thing. Okay, we got to take our positives away, but let's do it. And I think next time, I hope next time, that we can avoid these issues. And again, with all of Doug's recommendations and what Doug said in his presentation totally stands true with me as well. And I want to just wrap up with one other thing. It came across my desk, the CDC Social Vulnerability Index. So if you go to Centers for Disease Control, you can look at their index. I looked up my county, and this was the map I got. This was based on 2018 data. And then if we were to look at the COVID map for Suffolk County COVID-19 cases per 1,000, you can see that the similarities in this map are pretty wild, you know. So draw your own conclusions. If I give you an exercise here today, it's pull up your county's vulnerability index map and see how it matches, your thematic map for COVID, because I think the CDC definitely has something going on right there.
Wow.
So thanks to everybody in my GIS unit. Again, Eric, George, Doug, Santos, Shannon, they've done tremendous work for me. I want to thank the Suffolk County IT BI team, the business intelligence team. Really, they made it all possible. If they didn't do what they did, I wouldn't have had the GIS, the points, the ability to develop those points. I want to say thanks again to Frank and his crew and his program, the New York State GIS Program Office, SAM program. This has been one of those major foundational components that help us do what we do. And to any county that's listening here, I mean, I think it's imperative that you participate in the New York State SAM program, as it's been a wonderful success for us. And I want to thank the Esri New York City Metro office. Esri has provided us with wonderful support, and I really appreciate all the work that they've done. And least but not last, certainly New York City Gizmo. I want to thank Alan, I want to thank Ross, and everybody here for letting me chew up your time. So, any questions? I don't know if you want to open up the questions, or is that reserved for?
Yeah, that's reserved.
Okay. So, I just want to say thank you, and I look forward to discussing and sharing whatever I can. Thank you.
Thank you, Jim and Doug and Frank. I think these were exceptional presentations. I learned a lot from them, and it just hit home on points that we've been sort of whispering to ourselves, but here it is out in the open. Right now, we're going to move into our expert panel. The first one we're going to hear from, and these will be like sort of 5 minutes to say something, to comment, and to maybe ask questions. So the first expert panel commentator is going to be Professor Sean O'Hearn of Winter College here in New York. I'd just like to say about Sean is that he played an instrumental role with West Nile fever, and he worked very closely with the Department of Health, actually developing a model for predicting where West Nile would turn out. And I thought on the strength of that incredibly brilliant work, that the Department of Health was in the bag in New York City in terms of geocoding data and using GIS. And it was a real rude shock to learn that they had absolutely gone back to the Stone Age in terms of the way they were handling the COVID data. But that's just my opinion on that. I just want to bring on Professor Sean O'Hearn for 5 minutes of comments and questions before we move on to the next person. So, Sean, you there?
Yeah, can you?
Can hear you.
Yeah, okay. I'm on an island off the coast of Maine, so I wasn't sure. True. Fascinating presentations. I think, a big takeaway is the amount of infrastructure that needs to be developed and is being developed and has been developed to make this possible. We saw a long wind up to actually making, using the data for policy, policy making decisions. And I guess a bunch of things struck me. There was the fabulous presentations, really fascinating. I definitely want to show this to my class. But one that really stood out is the question of spatial and temporal specificity and how it relates to policy-making decisions. And I'd like to ask the speakers generally, what level of detail is needed for what type of policy decision-making? And I thought Jim's example of the police was very interesting because, of course, once that data accumulated, they were overwhelmed, and actually the only data that was relevant was the last 14 days where, there's risk involved. So that's one thing that I'd be interested in hearing about, the relationship between spatial temporal resolution and the types of policy decisions that relate to those different levels. That's probably the one that stood out the most. I think address standardization, the role of the state in helping with those standards is huge. We went through, that was a critical issue during 9/11, and there we had 3 keys. We had borough, block, and lot, we had address, and we had building ID. So we really had 3. The second sort of theme I'd just like to touch on, and Jim briefly spoke about this, is the idea behind contact tracing, tracking, and the relationship between geocoded data and some of the aggregated data that's being put together by people like Uber Media and so forth, that actually looks at movement data, because it's important to know where these cases are, but it's also equally important to know where they're going to and how different geographic units are either sending people out or receiving people, and what does that look like? Because that's absolutely critical, and that can be anonymized, actually, that aspect of it. So those are the two things that stood out, but brilliant presentations and great work, really great service to your counties.
I would say this, with the three speakers, starting with Frank and then Doug and Jim, want to respond to Sean briefly?
Yeah, sure. Thanks, Sean. So yeah, we give a lot of thought to both spatial and temporal resolution, and it starts with what's the schedule or the cadence or the rhythm of that thing we're monitoring? Are we monitoring fruit flies or tortoises, right? So what is the natural cadence? So if I were to test sewage, for instance, every hour, is that meaningful? But what's the, what we need to work with the epidemiologists and the medical community to know, okay, once a contact happens, how long would it take for infected people to submit a sample to the sewer system that would actually be measurable? Is that a day? Is that 14 days? So that's where it starts, is what is the real world phenomena? And then we look at a data system that takes best advantage of that. And in the case that drove me a little crazy was, and again, I see people are doing fascinating and fabulous work playing the cards in their hand. So if we're starting with hospitalization data, you can think about all the various things that add lag to someone getting affected and where that person might show up in hospitalization data. There's so many factors which cloud all the meaning. Was it the infection rate plus the comorbidities plus plus. So we're really that much further from the actual natural phenomena we're trying to model. So that's where we really need to back up to. Sewage testing is a good example, because then we're testing daily or whatever cadence is most appropriate, and we get this symptomatic and asymptomatic people that capture that all together. So great question. And the movement data is really fascinating. I don't mind if things are intensely complicated, as long as they're only complicated in one place. And how many people do we need to have figure out how to deal with trillions of cell phone tracks, right? We did devise a plan, although it was never implemented, but we have an idea that maybe every census tract has some base score for the infection rate. And then every movement of a cell phone from an infected census tract to another accumulates in that kind of inbound score. So every census tract would then just have one number on it, completely anonymized, that you've got a score of 1,000 because 1,000 people came to your census tract today from those census tracts that had a relative score of 1, right? And if they had a relative score of 5, then you have a score of 5,000. So that was a way to really kind of keep that anonymized and simple, and have that kind of data play into the really spatial regression, or all those factors which we would then use to understand the spread. So some ideas floating around there, but the complexity of that data really requires just the volume of it requires some really good methods to simplify it.
Doug, and thanks, Frank. Doug, anything to add? Unmute. Doesn't seem to be there at the moment. So, Jim, do you have a comment on Sean's questions?
Thank you, Sean. I appreciate that. Oh, Doug, you in?
Did you hear me? Can you hear me now?
Yeah.
Okay, sorry. Sorry to take your time away, Jim. So you saw my progression from zip code down to cells, for instance, and I was just looking at the spatial aspect, and we started looking at the time component, and I mentioned just the aspect, and we haven't put a lot of time into that because we've had to do, you know, so many the basic aspects that I think both Jim and I touched on today, but the time component is key that we need to try to spend more, especially if this ramps up a little more. And I mentioned the aspect that I think Rockland had, I think, more than 40 cases overnight. And just looking at those, you know, when you start to look at the time element, how 12 of those, I think it was, plus or minus, fell outside the window of 10 or 14 days already. So it's something that, and I just got an update from my staff who updated that. And though that number sounds very alarming, it still shows a downward trend in certain areas. And why that's important is because there's been weekends throughout this process where I've gotten calls from County Executive Day and others, and, you know, as the health department does, is it's something that we have to worry about. We're hearing there's an outbreak, and when you start to look at the time component, you know, it starts to, you know, show you a completely different story. So in our case, I just know we need to try to see what we can do to stay on top of it and hopefully be able to invest more time. But we struggle with that, like everybody, with staffing and what you're dealing with, other aspects. So that was really all I wanted to add.
Great. Jim, anything?
Yeah, again, thanks, Sean. What I wanted to say was with the regards to the temporal aspect of looking at this data is that, you know, it all comes back down to data again. So who's ever asking the question at the beginning, what data do we need? How do we account for it? How do we get it into the system? How do we add it to the database? That's what we have to work with. And then the questions come out of that. How can we use, or the questions just come naturally. So for instance, again, the chief police says, can you get rid of, you know, all of these points that are useless that have been on there for months? I just want to see what I need to know. What's at risk to me now? So that was important to him, and then we realized that's important to a lot of people, not just the police department. We developed the app, and then it was well received in the health department as well. And I think it's important that we understand what data needs to be put in this, because maybe we're not getting all the data, or maybe we're not entering it all that we need to. So that's just one point on temporal data. We could do perhaps more, I don't know. The other point you bring up about tracing and mobilization and tracking cell phone data. So from what I understand, one company, and I'm not really clear of the name, but I won't mention it, but they have all the cell phone data in the world, evidently, and they can tell where all these cell phones are moving if you have your geospatial enabled phone on. And from what I understand, if you are identified as a positive patient, then they'll track your phone and go back in time and look at any other phone that you were in contact with for so many minutes. Okay, and then start to capture that. Now, this is what I hear is happening or being thought about. I don't know that this is being done. And then somehow this is going to be worked into ComCare and the tracking that they're doing. Again, I'm still, as I said, feel like I'm in the dark room, reaching out to see who else is in there and how can I help. But that's the way it's going right now for me. So I hope that helps.
Okay, thanks, Jim. Ross, you want to take us to the next step?
Yeah, thank you very much, Sean, for your time. It was great. Next, I'd like to introduce Dr. Nadine Alame, CEO of Open Geospatial Consortium.
Thank you. Thank you so much. Thank you, Alan, for actually putting this event together and for inviting me. I don't know if you guys are aware or you're familiar with the Open Geospatial Consortium, but my comments are going to be around data sharing and interoperability and making location information findable, accessible, interoperable, reusable, fair, right? You know, nothing new. And I've been at OGC, Alan knows that, for about a year and a half now. So some of my comments are very passionate. For example, Jim, I was jumping up and down my chair when you were saying, why don't we have a RESTful service? And I was like, yes, Why? Because we know how to do this. The technology is there, the products are there. So I would like to hear what's actually stopping us. When Doug was talking about the models for GIS, I was thinking, you know, we're actually the big bubble that everything is in it. We're not even a bubble on the side or in the middle. And maybe we should stop referring to ourselves as the GIS people. Because we're way more than this. I was, you know, like listening to Doug again as he was very nicely put together the challenges, poor data quality and the weaknesses. I didn't see, you know, the data sharing, whether they're policies for data sharing or infrastructures for data sharing beyond the ad hoc, you know, the special arrangements. And then when I listened to Frank at the beginning, and I think, you know, we all hit on the spatial temporal, and this brings me back. We're like, we've been saying, or maybe I've been saying at OGC, you know, this geospatial community, not GIS, we're geospatial. We're way beyond systems, yes, because we're literally everywhere, to the point we're starting to refer to it as location, because this is maybe what's gonna click in people's heads to actually make the connections. But Frank, you say spatial temporal, and I say this community, we are the experts at space and time, because you can't look at one without the other. And this is where our value is. And I go back to the fact that, you know, just when I look at the OGC membership alone, at the new startups that have all these ideas and technologies, it's not, so what I'm hearing here is not the technology issue. So I go back to you, Jim, and I even sent it to you privately, like in big capital letters, like, thank you, why? So I would like to hear some comments about what can we do going forward to enable data sharing such that, you know, different counties or different entities can tap into the data at the right level of, you know, arrangement, agreement, visibility, granularity, and we have some sort of a data infrastructure, not that it's homogenized, but actually that we can all plug into it so that it's easier for us to connect the dots. And then we can build the dashboards, not, you know, one off. We can actually, we're using, you know, it is the data lake, but you can drown in the data lake. So I think about it as a spatial data infrastructure that's an organized lake. So I would like to hear your comments about going forward with respect to data sharing agreements. And this is on the policy side and the technical side. Thank you. So Jim, maybe why? You start.
Why? Yeah, that's the, you know, I'm usually in the area of asking where. That's what we do as GIS professionals, right? But I found myself asking that question a lot. Why isn't this available? Why isn't this done? Why aren't I being invited into that, you know, strategic planning, you know? But what really was the game changer was that once we were able to locate those positive cases on the map and build those public-facing maps, everything seemed to change for us. We really started to shine. We took off. We were able to show what we knew we had. You know, through the years, we've done a lot of work building our GIS platform, so we knew we were ready. And coincidentally, we had just started to play with dashboards right before COVID hit. You know, the JHU dashboard came out. That was like a big wow. And you know, I never saw the tsunami wave coming to us, so I wasn't really planning on doing that anyway. So I started working on these other dashboards based on, you know, the JHU. And I thought, wow, there's a lot of free data. There's a lot of great data going on globally. I was like, wow, that's terrific. So then we transitioned from making some of the other dashboards we were working on to doing this for COVID. And again, then it's I'm looking around. Why isn't this data so easily available? Why can't I map it? Why can't I get, you know, okay, I'm a county official, so I'm held to HIPAA regulations. I get it. I have that. What is the holdup, right? But then again, and Frank has brought this up to me, and it resonated with me when he said it so many times, is that the health department is a new culture unto its own. And I don't know if it's like what I've seen throughout my career. Everywhere you go, where you try and help with GIS, if they don't understand it or don't know it, they really kind of push you away because maybe they're embarrassed or they don't want to take the time or whatever it is. And then, you know, you get to a point where you're just frustrated by that. I don't even know how to help you anymore. So you get back to, okay, doing what you do, and you start putting up maps and data, and then people come to you if you're doing something wrong, and they say, you know, you got to pull it back or whatever, what have you. But I think the HIPAA thing is a card that's being played, you know, dare I say it, wrongfully, ignorantly perhaps. And I think that this HIPAA subject needs to be addressed, because it is, I think, the hand that is stopping all of us from doing more than what we know we're capable of doing. And I would just like to see that addressed. And you know, Doug touched on lobbying, and I think that that is a word that, you know, with what we're doing here, you know, again, to your point, we're not talking about technology so much here, we're talking about policy. And what has a lot to do with policy is lobbying. So if we as GIS professionals can be professionals, remove the GIS, as you say, which is a great thing, I think, and lobby, where do we have to lobby? Do we have to go to state legislative hearings and lobby there and say, you know, we're down in Suffolk County, I want to be in that strategic planning with you. I need to be in there. You don't know what you're missing. Is that what it takes? I don't know. So, you know, we talk about open data and sharing. Many times that's just a euphemism for I'll share what I got. If it's easy to me, I'll share, you know. But, you know, you ask me for something with somebody's name, you know, within 1 or 2 degrees attached to it, forget it. You're going to get the hand. And, you know, I get it, but you have to understand that we're county officials who understand HIPAA. So why can't we handle that data and trust us as professionals that we are?
Can you comment as well, please?
Yeah, absolutely. It was about 2 decades ago, we were involved with the North Country ice storm, and my IT director, super nice, super smart guy at the time, still a super nice guy. He said, Frank, the gun went off and you guys did a fantastic job building the car for the race. And I thought, oh, thanks for the compliment, but I never want to be in that situation again. We want to have the race car ready. And how do you do that? How do you have infrastructure and data ready for emergencies? You have that same infrastructure and data ready for day-to-day use. So there are certain areas, and I'm thankful that we're not content for very long. Like we celebrate, yeah. So Jim, thanks for the nice comments on the address data. Great. Take it for granted, moving on. What do we do next? You know, we don't celebrate that stuff very long because we're not content because there's so much more. But I just had my folks pull some numbers from this time last year till now, and our web services put out 427 million requests in a year. So, okay, great. A lot of those were the framework data layers that, you know, whether that's imagery or address geocodes, property parcels, those sort of things. But the real challenge now is how do we harness that capacity and be able to pull in what I call the business data, really the thematic data that has a location component, whether that's COVID tests or chemical storage permits or boat launches. You know, how do we pull that business data in some scalable way? And if I need to add a new staff member for every 100 new data sets that we put a web service out on, we've failed. We need to scale from a technical standpoint, but just as importantly, we need to be able to have procedures that work without scaling staffing. So that's one of the big challenges is building on the success we've had, but having things that scale. So we get these themes, we can just say, yeah, we can do that. We just spin it up. And when it comes to those services, anything that can be public should be public. And people are questioning me saying, well, aren't you using infrastructure dollars to pay for the infrastructure so people can use your data and they're making a profit off it and you're not recouping any of those costs? And I have 2 answers to that. One, I believe it's cheaper to manage infrastructure to handle the load than it is to manage the infrastructure and user accounts to limit that load. And 2, all of that is activity in New York State. So if you're delivering pizzas in New York State, great, use the geocoder. Then the taxpayers get hot pizza. Great. That's all activity. So we're trying to make enough data publicly available so we move the dial on the economy so that we have a more competitive place to live and work and conduct business and govern and provide public health, right? So it comes from that set of the default is that data is let it rip publicly through web services, and if there's a reason that we need to constrain some of the data, then let's just focus on those reasons. Let's not start from a position of this data is private by default because it's mine. Let's start from the position that data is public, and if we have legislation that requires us to restrict it, then we'll respect that.
Frank, can I ask a question though? With regards to data that we know is sensitive, that's covered under HIPAA. We have a group of people here that understand HIPAA. We know what we're obligated to do to comply to it. I asked the question in my presentation, why doesn't the Department of Health offer in there, I'm sure they have a technology unit, or they could work with your department, and why aren't they offering a secured REST service to that database? Why are they making it so difficult for anybody, specifically the county health departments, to connect to that data? If you think about what I said, the county health, one user account for the county to access state health department, I find that atrocious. It's mind-boggling. So we have to use that one account to then employ a robot. This is getting really creative, but really, does the Commissioner of Health in the state of New York understand what we're doing here to do what we're able to do? Again, if we didn't employ that robot, I'm dead in the water. I don't have those points. So again, the question is, I think, withstanding. Why isn't the state health department giving out a secure REST service to the county so that we can consume it painlessly? I don't know if you can answer it. I don't mean to put you on the spot, but that's my big question. I'm sorry, Frank.
That is a great question. That one right now is not mine to answer.
Okay.
We do have a plan and an architecture design in place to stand up an API gateway in front of a heavy-duty scalable web services environment, which would give us the technical architecture for anyone that needs to put out a REST service to then limit its audience to scalable, kind of self-authenticating set of users. We haven't been successful in getting the funding together to implement that plan, but it's not for lack of having thought of it and planned it out and dealt with it. But it is a wonderful question, and these are the kind of things. And I actually welcome the frustration, because it's that drives the positive change.
I'm sorry it's so evident.
Sorry, I highlighted it as
no.
But I want to say also thank you, Frank, for being so open here, and thank you, Jim, for your passion. And I think this is just one point, right? This is happening elsewhere in the country and actually in the world, and that's why I've been talking more about like a health spatial data infrastructure. I think, Frank, what you're talking about, a plan, but it's actually not a New York plan. It's maybe nationwide or even global if we can.
Absolutely. A couple weeks into the pandemic, I got a call from the GIO of Illinois, and he said, Frank, Chicago is 2 weeks behind New York. What should we get ready for? And boy, I should have been able to answer that question a lot better than I could have. Because what we learn in one area impacts another. And, you're absolutely right. This is not a regional, the worldwide data issue that we can learn from and do a lot better.
Doug, do you have anything to add?
Well, I've just come back to a couple of points both Jim and I have really pushed and continue. The HIPAA aspect is, we're always concerned about, first of all, I think he talked about the hand in the air, the Heisman position, but that happens. But it's, even the role on us and responsibility of all those that are involved, and even internally getting different opinions. It's, to me, I'd rather have other people identify what the cans and can'ts, and it be ironed out so that we clearly know where the lines of delineation are, what we can and cannot do, what we can and cannot share, and so forth. And I think that is such a huge obstacle for what we deal with, and almost prevented us from doing certain things at times as well. So I would come to that as a big issue. Certainly in our own case, Jim hit it as well. You can get our parcels online on our portal, but you're not getting owner. Owner is such a big concern, that aspect. So I understand, you know, the interest, and you can probably get it from other sources, link it up. But as I remember, even aerials years ago, my sheriff, former sheriff used to say, Doug, I know, and this was after 9/11, Doug, I know people can get it from many other places, but let it be from the other places and not from us. That if I pull up to a scene, a bombing or something like that, you know, at least it didn't come from us. So I have that message it burned in my head, I guess, for many, as we go through many of these aspects. So, but thank you.
Yeah, and if I could just follow up to Doug's points, I think, you know, you hit it right on the head. If these lines could be made a little bit more clear for us, you know, I remember the aerials issue many years ago, you know, if it wasn't for, I think, Google just pushing it, forget it. We all still have to be hiding our aerials behind our firewall. So, but again, there was no clear definition of when we could open that up or start that again. It kind of just evolved, and it took years. What I think we're looking at here now is we don't really have the luxury of that time for waiting for this to happen. What I think we need is we need to, you know, again, if it means using lobbying, then lobby to find out, you know, the answers to this. Are we going to get this or aren't we? Because if we go through this again, we're going to have, I mean, clearly this isn't going away anytime soon. And what everyone's talking about now is preparing for the next wave or the next pandemic or the next COVID. So, you know, this is the reality we're facing. It's post like 9/11. Everyone's in a different world. We're in a different world because of COVID. So now professionals, what are we expected to do the next time? And, you know, lessons learned, are we going to learn them?
Yeah, one of my slides, I hit a point. That's where I said pause. You got to take an extra little time just to pause and have some more discussions, whether you can even publish it, just because there is no line of demarcation, what we can and can't do. I think that would be so helpful to us.
Ross, maybe go to KC.
Absolutely. Excellent discussion. Thank you, Dr. Alamé. Next, I'd like to introduce Dr. Casey Rondello, Professor of Public Health and Emergency Management at Delphi University. Doctor?
Hey, everyone. Thanks so much for inviting me to participate in this conference. It actually, I'll make a few comments about why I think it's so critical in a minute. But I especially want to thank Frank Winters for opening the door, not just for me participating here, but also getting more involved in the collaboration between what's going on with public health and GIS, which is a theme of what I want to talk about in the few minutes that I have. For those that don't know, I'm a disaster epidemiologist. I'll tell you that most days begin with me considering that I have made a serious vocational error. Then when I get over that reality and blink my eyes a few times and dive in, you know, I want to ultimately frame my comments in a positive light. And I'll tell you why. Because most of the discussions that I participate in, it's a lot of frustrating and concerning and worrisome news. You know, so much of what has been said, I tick marked here to make comments on. But we have to begin by acknowledging what Jim just ended on saying, which is the reality is that we are very much continuing to be in the thick of this current crisis. You know, about 175,000 dead. You know, we epidemiologists predict that things will get substantially worse in the fall, probably 125,000 more in the coming months. It's in fact become the case that COVID will very likely be the third leading cause of death in the United States, behind only heart disease and cancer. So this is a situation that we certainly have come a long way and learned a great deal, but we have so far to go before this chapter in our nation's public health history is over. But that said, all of that said, as the last person to offer some comments, I've thought about ways that I can frame what I want to say in a positive light. To use the words that Jim used, a good thing out of a bad thing. And also emphasize for you just how critical the work that you're doing is. You know, and I guess the first thing I want to comment on is just how much the work that we are doing together, public health and GIS in particular, that work has become very much front and center. That's a good thing. You know, Doug talked about the struggles of using antiquated systems and having poor data quality and budgetary and staffing challenges, right? Jim was shaking his head wondering, you know, why wasn't this problem viewed as a geospatial problem at the beginning? Well, I don't think that you'd have that argument any longer, right? The political support is there in a way it never has been. The financial support is there in a way that it never has been. And so what we are doing now is very much on stage, and I think that serves to everyone's benefit. Secondly, there's a great deal of learning that's going on and research being conducted that wouldn't otherwise have happened. Frank mentioned the work that's being done by testing sewer water as a proxy for prevalence rates in given communities. Cutting edge stuff. You know, Jim finished by showing us a side-by-side map of COVID and CDC's social vulnerability and said, draw your own conclusions. Well, you don't have to be a disaster epidemiologist. I mean, there's clearly something going on there that needs to be explored, and that kind of work is happening that would have never happened otherwise. And then Frank began all this by talking about the difference between precision, accuracy, and resolution. We all know that the data, from your perspective, geospatial data, from my perspective, health data, has historically been stale and outdated. And from an epi perspective, that really limits its value. Well, now information is being think about how many thousands of addresses have been fine-tuned and location points been fine-tuned because of COVID that wouldn't have happened otherwise. And that's information that will ultimately benefit us down the road. I think perhaps the biggest silver lining, if you will, that from my perspective, is the fact that, and I bring this up because of the fact that I've been asked to participate in this, and that's the cross-disciplinary collaboration that has always been out there in the ether, but I think has been made very real and tangible through COVID. We all talk about, there was discussion about the different cultures, the different vernaculars of the disciplines. I think a lot of that is coming together. I'll tell you that I have learned, it's got to be a college course's worth of GIS just from doing my COVID work. And I suspect that those of you in the GIS world would probably say the same thing about epidemics. And so there seems to be, from my vantage point, less siloing, greater integration of cultures. And that's not only going to benefit us as we enter the second half of this crisis and what's facing us in the fall and in winter, but I think it's going to benefit us a great deal in what we do moving forward, which is going to continue to rely on collaboration that's cross-disciplinary. Finally, I guess the one question I'd have that I ask you to consider is very often in this discussion today, I've heard GIS be framed as a service that largely supports other disciplines. Examples were given of ways in which GIS has supported public health, OEM, public works, and the police department. I wonder, it's got my gears turning, and I wonder what you would consider the best ways in which other agencies, other disciplines can support you. because what you're doing in GIS is exquisitely hard. And the more I learn about it, the more I understand the challenges that you folks are, have been facing for years, and that I'm just sort of opening my eyes to, what your daily life is like. But what are the ways in which those institutions that you traditionally support can support you in understanding geospatial data's application to our disciplines, in understanding your vernacular and your challenges and your research? I wonder about that, and I'd be curious to hear your responses.
That's great, Casey. I really appreciate all the collaboration, and you bring us back to the cold reality, but in a really positive way. And there's a lot of people that are just kind of wigging out and losing their minds. But I think those of us on the call and those who are going to be listening to the recording can take some solace in the fact that they're being proactive and they're doing something, right? And that's one of the few things to keep in mind that zip down through this whole thing is yeah, we're making some positive change. And if everybody in the world leaves the place a little better than they found it, then we're on the right vector. So thanks for that silver lining kind of spirit. But really interesting twist. I didn't expect that question, but some things come to mind. What can people in other disciplines do to help the geospatial community? A couple things come to mind. We talk about building the nation's spatial data infrastructure, right? So this huge network of a digital representation of our world and its interactions, right? And we can think about that as an intensely complicated jigsaw puzzle. And Bill Johnson at the year meeting used a jigsaw puzzle analogy, and he said, if you're walking away from that jigsaw puzzle table with a piece in your pocket, shame on you, right? You don't have to build the whole puzzle. You only have to put your piece on the table, and it'll fit in, right? So that analogy kind of works for me. And so maybe it's an understanding that there's information that is as important to maintain as the physical infrastructure that you maintain. Department of Ed is a good example. So they have lots of policies and programs around schools. Well, the information about where those schools are and who is principal and all sorts of just basic information about a school is useful for so many things. So Department of Ed, sure, they want to put out school report cards or do district mapping, and Department of Tax and Finance realizes that they need to know the school district so they collect proper and apportion taxes. Well, a county social worker that is trying to help a sex offender who is just let out of prison find public assistance housing needs to understand the parole restrictions, and this parolee can't be within 1,000 feet of the school. The people that are maintaining data on schools have customers for their data who they never are going to meet. So they have to put their piece on the table and realize that lots of people will do lots of good things with it, right? So that's really the point that I would give to people who have information. Whether one of the things we did years ago was maybe some would have thought some of the least likely people to be in the information business were Department of Public Works or DOT snowplow drivers. Well, they had information while they're driving their truck that people need. What's the road condition like, and is it what's the visibility? And they were able to radio that in, and that went on an interactive map. And we got calls from school district superintendents saying, "Oh my God, every morning I used to have to call DOT. Now I see it on your map, and I can make better informed decisions." So, information that you need or that you have in front of you, in no matter what line of work you are, can play in this national spatial data infrastructure, and it's going to value people that you probably will never meet. And you've left the world a better place in the process.
Yeah, and speaking from a clinical perspective, that ever increasing specificity allows us, adds so much to what we can extrapolate, what the clinical value is. And I can see how that can be for, as you mentioned, the education world and public works and others. So I think that there's a lot of synergy happening here that is benefiting us in the COVID response, some of which we expected, and frankly, a lot of which we didn't, but is happening. But I think that those are lessons learned that, you know, we'll be able to leverage to our benefit in the future.
Ross, you know, it's getting close to 4. So I don't know, should we cut short discussion and move to just the conclusion, or what do you think?
Yeah, it might be a good idea. See a few people dropping off, and I want to give an opportunity, if you agree, to allow some quick some questions from the audience. Right before we get to that, actually, Jim or Doug or one of the presenters, ComCare has been mentioned on a few occasions. Can anybody give a 30-second quick definition of what ComCare is and what they do for the audience's benefit?
Well, I'll start off. Can you hear me?
Yes.
Yeah.
Okay. Well, yeah, I'll just say that again, I'm not 100% familiar with the process right now. Suffolk County is using it. We're employing people to work with the ComCare system. There is how the actual system is being used, I don't know. I've never actually sat and got trained to do it. That's one of the things I would like to get to do. I do know it's being used, and I think it's being used in conjunction with some of the applications that we're using. The one I mentioned earlier was the cluster application. So some of these ComCare professionals are identifying where these events have happened when they ultimately understand that where these people who are positive, where they've been. So I do know it's being used a great deal in Suffolk County.
Okay. All right, so let's move on. Does anybody, if anybody has any questions pertaining to the our discussions, or questions directly to the presenters of the expert panel, please, if you could, raise your hand or enter it into the chat, and we'll follow up with you as soon as we hear from you or see your hand raised. Maybe in the meantime, while we're waiting, I guess what I'd like to note that Amy Ju has been in the process of developing a questionnaire about the use of precision location data. And Amy, if you're still there, would you like to say a few words about the questionnaire while we're waiting?
Sure. Can you hear me?
Yes.
Okay. I want to thank first all the presenters and the panelists for the excellent presentations and the rich discussion that we've been having so far. Alan and Ross have drafted a questionnaire about how GIS is being used in the different jurisdictions in New York State. The draft will first be sent out for review and edits to the points of contacts for the New York State regional groups that comprise the regional committee of the New York State GIS Association. It's about 20 individuals there. So through this survey, we will get a sense of how extensively GIS is being employed in support of COVID suppression operations. And afterwards, the survey will be sent out formally so that we may learn more about how extensively GIS is being used in different jurisdictions in the state and beyond to support their COVID operations. So look out for that email. It'll be arriving in your inboxes shortly. Thank you.
Great, thank you, Amy.
Ross, we have AJ Gupta with his hand up who would like to ask a question.
Absolutely.
Hello, thank you all. Thank you for this session and for inviting me. My name is Ajay Gupta. I work for a public health firm that has built a GIS. Enjoyed all of the presentations and the great discussion, and happy to see GIS used so much in the healthcare space, which is really the space that I come from. One of the things I thought may be missing, and maybe we just didn't have time to talk about it today, was any kind of assessment or measure of how GIS improved care delivery or saved lives during the pandemic. That's something that we've sort of done here for Maryland and a few other states that we work in. Has there been anything along those lines in New York? Thank you.
To clarify, are you talking about a metric, AJ? Some sort of metric that compared to lives?
Yeah, some sort of metric, some sort of assessment that can speak to the real value to healthcare, which is always down to costs and lives. Right?
Yeah, good question.
Really good.
Yeah, I don't have, and nothing comes to mind right away. But you know, how do you put a metric on how many lives you think you potentially saved because you created the heat map that alerted everyone to the hotspot, where they then developed or stood up the test centers in those hotspot areas, right? So the only answer that I can come up with.
It's complicated, right? It's relatively straightforward, right? So if you were able to take any actions that led to preventive measures to stop the spread of even a few people getting COVID, considering we know the death rate and the case fatality rate, and we know the population and the population density of those areas, we can make an educated guess as to how much of an impact controlling the spread and therefore saving lives we've had through our contributions to this.
Yeah, I'm not quite clear on the methodology and how you go about producing that metric, but again, I'll work with you. I mean, again, when we created the heat map, which was really just a thematic map of the communities, you know, it was glaring. It stood out where these numbers were, and that's immediately where we set up the test center. So that visual analysis right away started something in the strategic process that we believe saved lives. So I think, you know, if I had to point to it, I can't give you a number, but I would say right off the bat, we know that GIS had a big impact on saving lives. I'm definitely convinced of that. I just don't have a number to put to it.
Cool. Thank you. Thank you for taking my question.
That's a great question. And we've given some thought to a methodology where we would understand the parameters which, and actually do regression to come up with an equation for if these characteristics exist, they explain this level of the variance, and you get a coefficient. So you take this variable times this coefficient plus this variable times this coefficient, and you come up with an estimating model that then can be used in a different geographic area with those same parameters, and you would estimate the COVID rate. Now, those rates would only be true if the same behaviors happen, and hopefully this behaviors will be different because you will have taken preventative measures.
You want to watch?
So then you can do a subtraction between the rate experienced versus the rate modeled, and you could see how well your preventative measures have happened. So GIS can't take credit for all of those preventative measures, but a spatial regression approach could work to model and then compare the results to the world observation experts. So just an approach. So yeah, I really like that thought to put some metrics.
Thank you.
Great. Do you see any others? I don't see anything in the chat.
Nope, nothing in chat. No other hands up.
Okay.
Ross, if I could take a second, just 1 second, just to respond to KC, because he did pose a question I had an answer to. You know, what can the departments or agencies do for us? And I just wanted to chime in there. I didn't want to leave that unanswered on my end. Is that I think one of the biggest things they can do is make time for me and learn GIS. And if you do the first, I'll help you with the second. So that's the biggest thing, because, you know, in a time of crisis, it's now, I know I'm not going to get your time. You know, let's use the Commissioner of Health. I knew I wasn't going to get time for him, so I had to make videos for him so that he could watch them when he had a second. Okay, so, you know, it's imperative, I think, that people in your organization make time for you, and then you can help them more, and they'll be better off. So that I just wanted to answer that. Thank you.
I appreciate that. Thank you.
Great point, Jim. So I guess on that note, thank you for attending this workshop. We hope this provided some takeaways that will spur further discussion. And I'm convinced these simple discussions are enough to create the behavioral change that we're all looking for. Please email Alan and I if you have any comments or ideas about how we can continue this dialogue. And Alan, do you have anything to add?
No, just thank you for everyone for participating. I think this has been a terrific session. Got a lot of information transfer going, and it's all been captured. So once we get the sign-offs from all the speakers and the expert panel that we can release this, we would like to share it around. But first, we're going to go and make sure that you're comfortable with everything you said being broadcast to a wider audience. But thank you all. I think this was terrific.
Absolutely. Thank you.
Thank you, Alan.
Thank you.
Thank you, Ross.
Okay, thank you.
Have a good
you.
day, everyone.
Thank you, everybody.
Bye, everyone.
And thank you, Michelle and Amy.
Oh, you're welcome. You're welcome.
You're welcome.